Good afternoon, everyone, and thanks for coming to our podcast today with Southwest Council. Today, we're going to be doing a Zoom with Kelsey Custodio from the Recovery Centers of America, and we're going to be talking about older adults and substance use. Over at Recovery Centers of America, there is a specific older adults program, so that's why we wanted to invite Kelsey over and have some conversations with us.
And thank you for having me.
So Kelsey, can you tell me a little bit about the older adult program?
So the older adult program is called Evolutions, and it was developed about a year ago, I believe, if not a little bit longer than that, because of the need. There was an obvious need for separate, right? Separate our younger population from our older population, especially when it came to small groups. Gone are the days of thinking that in treatment, one size fits all. And, sometimes when we're new in recovery, we tend to focus on the differences rather than the similarities. And that was something that would happen, the older gentleman that maybe started drinking too much after he retired, didn't think that he had anything in common with the young kid that's never even had a job, that's 18 years old and using opiates. So instead of focusing on we both want to stop and we can't, and that's like the commonality of it, the focus becomes what are our differences. So we definitely saw a problem and a need. That's what we saw. We saw a need, and the solution was creating a separate track for our older adults, like I said, called Evolution. And so there's kind
of how long has Recovery Centers of America been in existence? I know you said the older adult program has only been 1 year, but
in Mays Landing, 6 years in Mays Landing, and then we have multiple facilities that came after that that have been popping up all over the East Coast. The closest being Devon, Pennsylvania, and then our sister up in North Jersey or Central Jersey, actually at Raritan Bay in Sayreville. So one of the things that we found, especially with our older adult populations, it tends to break down into two groups. Either that older adult that has been using a substance for most of their life, or actually those that haven't had a substance use disorder. It's come about older in life due to maybe a major life change. So retirement tends to be a really big one, because what happens is, especially when it's a new addiction, it stems from that lack of purpose, a lack of fulfillment of time where there is no more work. I've also seen it personally in patients that have lost a spouse, losing a spouse after 50, 60 years of marriage. And so with that, we tend to see a lot more alcohol use. And then as we grow older also, we have ailments. I say we, because I'm starting to move into that. Dare I not say I would be a fit for the Evolutions program. However, I would definitely meet the age criteria.
So
go ahead.
So you're kind of saying, like, you notice that older adults a lot of times feel like they're going through so much that a younger person is not. And so this program is more tailored to someone who has gone through more life experiences than someone younger, and they're going through more significant changes in their life than maybe someone who, when they're younger, like losing a spouse, which is a terrible thing, or retiring, which is supposed to be a good thing, but can sometimes be triggering.
But it's exactly, and they need to learn to identify those triggers, right? What are those new triggers, for the person that retires and now maybe used to grab a beer after work with the guys, but now he's home all day, right? So it's almost a loss of identity. I was this guy, I was this iron worker, I was this electrician, I was whatever that job was. And now that I'm not doing that, who am I? And so a lot of times boredom can be attached to that kind of circumstance. I know someone who recently lost her husband after 50 years. there's no issue, but there's, again, is a very serious loss of identity. Like, I was this person's wife since I was 20. Now I'm 70. Who am I without them? And so you're talking about not only a trauma, but and a loss of identity, but also maybe some boredom, especially if you spend a lot of time together. You're talking about depression and anxiety about what's to come. So there are a lot of factors in the older community, I think, that the general population doesn't always think of, right? Especially if someone hasn't had a lifelong issue with any substance use disorder, but it's new.
Yeah, absolutely. And I think a lot of times it might even be harder for an older adult to recognize that it's coming into a problem because they did their entire life maybe go for a beer after work and that was fine and they were able to control that. And now all of a sudden it's turning into something more. And without the proper education, they could just more so not understand that it's a problem and just more so feel like a failure.
Right. And when you talk about the problem, like not know what that is, like not even see it, it's one of the things we're going to focus on as well with our older population. Like, what are the triggers? Like, is it at night? Is it when you're home alone? Is it, and what can we do in lieu of that? What do we need to do on an aftercare plan? So what are triggers? What are new coping skills? It's all inclusive as far as, we need to look at all of it, not only what has happened that has caused the problem, but now what is the solution moving forward?
Absolutely. And so in your older adult program, is it still the same type of model where you're doing a lot of group and individual work, or is there different activities that you do in an older adult program?
So that's going to depend on the therapist. So there's still going to be, so this is a track where primarily it's going to be, their small groups are different. And they will always be with the same small groups. So the focus on that, the Evolutions program is primarily done in small groups with the primary therapist that's going to be guiding that group through those coping skills. So it also tends to be like that support system for the 30 days, because when you have a group that are in this, age group and all experiencing similar situations, some the same, some different, but similar, they're going to start to be able to kind of go back and forth and get used to that help that can come with 12-step programs or therapy and group therapy after treatment. So, sometimes when you get the older adult, maybe that's never had a substance use disorder, that's a new learning and coping skill to share feelings and share circumstances with strangers. So the time in treatment is absolutely, imperative, learning how to do that comfortably. So if they do leave and either do group therapy or maybe individual therapy or 12-step meetings, they already have that experience with beginning to share feelings at that group level, which isn't always easy, especially in the beginning.
Yeah, to build off of that, you're mentioning exploring feelings and discussing your feelings is an obstacle that older adults might be struggling with because it might be the first time in their life that they've ever explored those feelings. What are some other obstacles that you think our older adults might more specifically face as they are getting treatment?
So definitely not wanting to address the addiction because of external factors. Like, this is just because I'm newly retired. This is just because my my spouse has passed, or whatever the external factors are, and not believing that this is an internal issue that's going to have to, we know that addiction is a mental disorder that has to be addressed on many levels. So a lot of times looking at the circumstance of what caused the excess drinking or any type of substance use, and then thinking that if that gets changed, like if I just develop a hobby now that I'm bored, so maybe, So looking at the external rather than the internal factors. Also, when it comes to medications in our older adult population, you have health concerns, right? So, and a lot of older adults don't want to come into treatment because of health concerns. But, what we need to realize is these are medical facilities as well that can address a plethora of, health issues. I mean, obviously we're not a hospital, but we have a full 24-hour medical staff that can address so many issues. In addition to substance use disorder, a lack of insight to addiction, I feel young. I'm not necessarily young. I feel young. You're much, much younger. And we come from a time where we are blasted with information. I mean, obviously I get a lot more because I'm in the field and I look for the information, and you at your age, you get, substance use disorder education in school and courses in college, and it's all over the news now. And it's like, public enemy number one, so to speak. But, that 50 and older population, if you haven't ever had a reason to investigate addiction, you're not probably even going to recognize it. Your average older adult isn't going to drink glasses of wine every night and months down the road not understand why they're waking up shaking. They're just not going to have that information. So definitely a lack of insight, lack of knowledge of how addiction affects not only the body, but the mind as well. So there's a lot that gets missed. And we also see a lot of lack of hope, because it is a depressant, and a lot of society, if you're not educated, you don't know that. Most people would think the opposite because it makes you feel good when you first drink, but that's the short-term effect, and the long-term effect is usually it is obviously known scientifically as a depressant. And when that sets in and hopelessness sets in, they begin to believe, especially at a certain age, there's nothing I can do about the problem. So.
Absolutely. Do you think that also maybe our older adult population, do you feel they have less of a support system, or more of a support system, or a little bit of the same?
I think less. I would definitely think less, especially when we're from what I've seen personally. Because again, if we're talking about a lot of the factors, and I know I'm focused on a couple of, the primary factors, there can be all kinds of factors leading to addiction. So, you want to tie in, loneliness ties into that lack of support, right? Because say you're just bored now because you've been retired, or even worse, you've been let go because of your age and you still wanted to work. So that support system that you might have had for the last 20, 30, or 40 years could easily have been the other employees wherever you work, your coworkers, or a spouse. So you lose a spouse. Well, most people that are losing a spouse at an elevated age, your children aren't living at home. At least most of us would hope they wouldn't be living at home. So I'm sorry, now I'm talking about my experience. And a lot of even kids. So, I'm a 50-year-old woman and the daughter of a 70-year-old mother. If I wasn't working in substance use disorder, I wouldn't think much about my mother having wine most nights. I mean, and not that she does, but I wouldn't, so, kids are popping in, popping out. So yeah, definitely a lack of support is a barrier to, receiving treatment.
And you mentioned like an older adult, like coming home and having a glass of wine every night and things like that. Do you feel, after you've discussed a little bit with your clinical staff, do you feel that that is going to have a larger impact on an older adult, maybe because of their medication, or maybe because of their state of mind, that, drinking, their alcohol intake is going to have a more negative effect on their health?
Absolutely. Because usually the alcohol, we're seeing issues on top of things that are already beginning to happen. I don't even want to go as far as dementia, but, if there are already indications of forgetfulness, we understand that older adults begin to lose their equilibrium. That's how come you don't see many 70-year-olds on roller coasters, right? It just doesn't sit well anymore. So you tie in alcohol to that. So what we see is more falls. A lot of times, unfortunately, that's how an adult child of maybe an isolated alcoholic might identify that problem, because mom or dad, you go to visit and there's a bruise, and or a broken wrist, or you start to see not only some mental deterioration, but you also see some physical aspects of what drugs or alcohol can begin to show on the body.
Yeah. So it's now having a lasting impact on not only their mind and exacerbating their depression, but it could be exacerbating any other of their physical health concerns, and even interacting poorly with their medication and causing an adverse reaction that way.
Absolutely.
So what do you feel are some risk factors of an older adult developing a substance use disorder?
So
We've talked a lot about like grief as being a risk factor, and retirement. Do you think that maybe a new diagnosis of a health disorder would also can be considered a high risk factor?
Absolutely. We talked about the loneliness and the loss of identity, loss of purpose, life changes, but we are talking about older adults that might be now facing new health issues, chronic pain. You're looking at things like rheumatoid arthritis. So, and obviously we are at a place where doctors have become very aware, especially like when it comes to opiates and such. But there's still higher risk factors with, maybe an older adult not having the education on opiates. And, I don't know if you've ever taken a Tylenol and maybe your headache doesn't go away, and a couple hours later you take another one. And so, but we can't stress enough how important it is not to do that when someone is using opiates and start to build up that tolerance. So we see that. And one of the other factors is that inability to manage and cope with emotions, just because there wasn't a lot of focus 50 years ago, 60 years.
It was more shove your feelings down.
Emotional health. Exactly. You don't talk about things outside the house. So if you're struggling, who are you going to share that with?
Yeah. So you would say that also, that mindset of our older adult generation is kind of automatically putting them at a disposition, because they're not developing healthy coping mechanisms for the life changes that they are now starting to go through.
Absolutely. Absolutely. And we talked about, like, you asked the question about identifying, an issue. I mean, if others around them aren't identifying it, we certainly can expect them to identify that this is what this is, right?
Yeah.
Because that's usually we're usually the last to realize it, honestly. So if there's not people in their life, a strong support, or people looking for that, then it can go undetected, unfortunately, for a length of time that's going to end up warranting someone coming into inpatient treatment.
Yeah. And it's important to, I think, express, which I think you've expressed several times, that, inpatient treatment, especially your Evolutions program or your older adult program, it's a sign of strength to be able to go in there and get help, and you're surrounded by other like-minded people who are going through similar circumstances. And that's what's great about this track, is that you are around people that are going through similar things as you. There's smaller groups, so you don't have to feel overwhelmed by the amount of people that you're with. And, they're all going to be within your same age demographic, going through similar moments.
And the average size of our small groups is 8. That's the average.
Yeah. So so they're not ever going to be bombarded by amount of a bunch of people, and they're really going to be able to focus in on that help that they do need and focus in on themselves. And although that might not be the usual of what they grew up with, that is now considered a healthy thing to do, to take care of yourself, and not just physically, but emotionally as well.
Absolutely. Absolutely.
So what do you feel after, I know that you've talked to your clinical staff to prepare for this meeting.
Absolutely.
What are some like signs and symptoms that our loved ones, or even our older adults themselves, should kind of look out for when it comes to noticing that someone is developing a problem?
Absolutely. First and foremost is the isolation. And I did already talk about that a little bit, because first of all, that's coming naturally because maybe this individual is alone for whatever reason. But say, if they're not alone, maybe they are in a marriage or relationship, wanting to spend more time away out, and not like the healthy amount of time that one wants to spend away, because we all need that.
We all need a little breather sometimes.
Yeah, absolutely.
But this is like
I don't worry about my husband when he's working out in the shed, but if he didn't come in to eat, I would begin to worry, or a very negative attitude and disposition associated with that isolation. I want to be left alone. Don't bother me. Or in the case of maybe where there's an individual, a parent or a friend, and they don't want their friends coming over anymore, or they make up excuses or reasoning behind, no, I don't want you coming over. It's okay. And they're choosing isolation over involvement with others. That would be a very key point. And something, if it goes past, this is just a phase, she wants to be, or he wants to be left alone today. Once that's kind of fine, then we want to make the extra effort to, insert ourselves. What is going on? Let's have lunch, because the symptoms that we talked about, or are going to talk about, you're going to be obvious if you spend much time with an individual. So if you start seeing unwarranted isolation, insert yourself into that person's life, have lunch, bring something over. And even if they don't want you to, if you love them and you're concerned for them, hang out a little while. I would say that's the best thing. I already talked about the memory loss. And I'm not talking about, your average.
Oh, where'd I put my keys?
If so, somebody should be watching me every day, right? But something that it almost doesn't make sense. It's sudden, because it would be sudden. So, and it doesn't mean that it's necessarily substance use disorder, right? It could be just a sign of getting older, but it could be a symptom of abusing some kind of either alcohol or some type of narcotic. So it's a good thing to look for. And then just impulsiveness. The person maybe that's always been level-headed is now making impulsive decisions and seems slightly irrational, and that would be something that would come and it would go. So these are some of the main symptoms that you could look out for, like I talked about earlier. Even things as little as bruising, like, is it just they bump into the wall, or Mary have too many and fall down and she's not telling the truth. So it's about awareness. If something doesn't feel right, trust your intuition enough to at least pay attention to the signs and symptoms.
And some other physical symptoms, I think also, maybe more specifically for alcohol, would be if someone didn't have a drink for a while, maybe developing a tremor, or extreme flushed skin more often, right? That's another physical symptom that someone might see when their loved one is more dependent on alcohol, but they might not have had a drink yet that day, or something along those lines, right?
Yep, absolutely. Yeah. Absolutely.
So, and if we are around, which is hard right now because we're in a COVID situation. So the whole isolation is very hard, I think, for family members to know whether they're isolating for their own safety, or if they're isolating because they are developing either a mental illness or a substance use disorder.
Right.
So I guess a way now we're having to try and fight isolation in a more virtual way. And I think
which can be difficult because a
yeah,
lot of times for our older adults, even to start switching over to a virtual kind of connection, you have to be there in person to kind of help with that.
yeah,
However, I mean, our population is getting, especially our older population is getting vaccinated and things are opening back up. So I think this is a good time to have this conversation.
yeah, absolutely. So we said, look for maybe slurring of the words, bruises on their body, wanting to be isolated from their loved ones and no longer engaging in activities that they once wanted to engage in. Memory loss, but not just your usual
unexplained, unnatural memory loss.
Yeah.
Your loved one, you would notice that sudden change.
Yeah. Absolutely.
Something that doesn't seem quite right. Like, trust your intuition. There's people like you out there, people like me, that if someone is not sure, I can't tell you how many calls I've gotten over the years where someone isn't calling to say their family member has some kind of substance use disorder, but they want to know what substance use disorder symptoms look like. Like, they're looking for help in defining whether there is an issue to begin with or not. So, I mean, there's people like us out there to help.
Absolutely. Yeah. And if a loved one thinks that they are noticing some of these symptoms of their older adult grandparent or mom or grandma, I already said grandparent, what do you think that they can do to help support their loved one? Like, how do you think that they should maybe have an open conversation about what's going on and their concerns?
So there's support prior to and then after. So prior to is spending more time with them, being more involved, asking questions, and just being a little more hands-on, because if that happens, you're going to be able to see the trends. I think once that some type of substance use disorder is identified, there's several routes. So, one of the things we talk about are boundaries. If mom doesn't drive and she's asking you to go purchase her alcohol and there is a substance use disorder, these are things you have to be able to set healthy boundaries. I'm here for you for this, I am here for you for that, but I can't support whatever the addiction is. If it's a suspicion of, medication abuse, we need to support them in going to the doctor with them. We need to support them like that. We also want to discuss treatment. There's many different levels of care. A person may not need inpatient. We might start at the outpatient level, and sometimes that might be a little, just a conversation. Maybe there isn't a problem, but let's just do an assessment, a phone assessment, and see what the professionals say, right? So we don't want, anybody that's not a professional out there trying to make this final decision and diagnose it, but you can support by calling a number, calling Southwest Council, calling 1-800-RECOVERY at Recovery Centers of America, getting on the phone with someone who can do a medical assessment and determine whether the person has possibly a substance use disorder.
And I think, like you said, just like sitting down and having that conversation with them, like, hey, I'm concerned about these signs that I've been seeing. What do you think's going on? Do you think that you're drinking a little bit more than you should lately?
Right.
Are you not able to stop like you've wanted to, or slow down like you've wanted to? And I think that, knowing that there's resources like Recovery Centers of America, you're able to educate yourself on that and just say, hey, like I saw or I read about this, and what do you think about this? Like, do you think that this would help you kind of curb your drinking, stop drinking, or stop abusing your medication? Like, they have doctors on staff, or, hey, I heard about Southwest Council, they have recovery coaches that like can have these hard conversations. with you about like what's the best route to go. So, I mean, I think that's also an amazing thing that a family member can do is just say, I've noticed this. I'm not accusing, I'm not saying, but I've noticed a change in you, and I don't like that change, and I'd like to get back to where we were.
Absolutely. And one of the healthiest things, and probably one of the least popular things to do, is seeking out your own treatment. So a family member that really has come to the place where they are pretty sure that a family member has a substance use disorder and maybe isn't ready to do anything about it, seeking treatment for yourself. And so whether that be with a therapist that maybe has some experience with substance use disorder, or just simply a 12-step program such as Al-Anon or Nar-Anon, to get the experience of others and how they dealt with similar situations. So that's often, if you can't get help for your loved one, start seeking help for yourself. And in the meantime, that's, we become healthier and are able to maybe work with a family member better on a more positive note by getting help for ourselves as well.
And just to explore a little bit more for our listeners that might not know what Al-Anon or Nar-Anon are, okay. They're 12-step groups for family members who have Absolutely. A loved one struggling with addiction. Well, they don't necessarily have to be a family member. They just have to care about someone that is currently struggling with a dependency, whether it's to alcohol or drugs. Correct?
Yes, absolutely. And Recovery Centers of America ourselves has a family program that is free to anyone who's interested. It's called Seeds to Recovery. And I can share that link with you, and you could put that on the website later. It is normally monthly. It is not limited to anyone that attended Recovery Centers of America. It is for anyone in the community that has a loved one or a friend or someone they know struggling with addiction, where they can receive not only education, but support for themselves. And we just talked about that. Sometimes the best thing you can do for someone else is to educate and help yourself, and you'll find the solution in that direction.
Yeah, I mean, it's like the saying goes, you can't fill someone else's cup if your cup is empty. Absolutely. So, you have to take care of yourself before you can help take care of others. Yep. So we've already talked about, how the pandemic has affected our older adults because of the isolation. But what type of advice do you think that you could give for any older adults that are listening and they're on the fence about treatment? They might be able to recognize that they are developing or have a problem, but, they just don't either think it's bad enough to get treatment, or they're afraid, so they don't want to go. What advice would you give them?
Education is the key. Education is the key, like finding out. And if someone is curious about that, my first go-to always, but I have to remember our age population, right? My first go-to would be to start Googling things, or 1-800 numbers. Health and Human Services departments have numbers and departments specifically geared towards substance use disorder. The Southwest Council can point people in the right direction for substance use disorder counseling and information. There is a plethora of information out there today. Again, if someone doesn't have access to a computer, they could go to their local or call their local Health and Human Services or Board of Social Services. There's so many resources, but finding out and getting the information and getting educated is the key.
So a way you feel for our older adults to be less afraid about treatment is to educate themselves about what they're going through.
Absolutely. And, one of the things, I think one of the fears going into treatment a lot of times is this idea that treatment is going to be similar to going into a hospital, or it's going to be similar to going to jail. And it is absolutely none of these things.
So give us an idea of what it's like at Recovery Centers of America.
So unfortunately, I don't have a virtual tour set up, but we do have virtual tours online. I could send you that link as well. So when we're done and this goes up, someone could have access to that. but we pride ourselves on being a treatment facility that feels like home, right? So aesthetics are very important to us. The way that a person feels when they come to us is very important. You know, from the time that you come and where you're greeted, to the rooms, which have beautiful pillow top, you know, full beds, you know, there's privacy barriers in rooms. There are only 2 to a room. There's never any more. There are sometimes options for private rooms. Every room has a TV for each patient. Some may think that is much, but if someone has never experienced detox and the need to be alone and experience those feelings, like it's a comfort. Think about when you're home and you just want to go to bed and you want to be comfortable in your own bedroom. Like that is the effort that has been put in at Recovery Centers of America. If someone is more active, we have a full gym along with a gym instructor, along with a nutritionist. Our dining is, you know, 5-star to say the least. It's also, there's many selections. You're not going to go to the dining hall and tonight there's chili and cornbread and that's it. That's all you can have. If you don't like chili, you're out of luck. No, there's going to be a lot of other options, a lot of other meal options. There are always, and that's the same with breakfast, lunch, dinner. You know, it's going to meet the needs of the pickiest eater. And these things may sound like a lot to some, but these are the things that can make being in treatment comfortable, you know, from a comfortable bed to, you know, our, to, you know, like I said, from a comfortable bed to friendly staff, to a clean, beautiful environment. We do allow smoking. So there are areas to smoke, but we also have beautiful areas for sitting and reading that are smoke free. And I've often noticed, like a lot of times, that is the area where I will see some of my older adults because they don't want to sit over here with the young people that are all smoking. They want to read a book during their quiet and free time and kind of, you know, be more reflective. So I feel like we offer it all. We really do. And I'm just really proud of what we've done with our older adults.
So knowing that, you know, it's going to feel like home, or at least a home away from home, and it's not going to be such a clinical experience. But there is also doctors on standby to address any concerns, should there be any health concerns, that could also help kind of alleviate any fear that an older adult may be experiencing when they're preparing or thinking about going away to get help.
Both medical and psychiatric. So both medical health or physical health and mental health. So we have, you know, full-time doctors on staff. We have full-time psychiatrists on staff. We have full-time nursing. So all needs can be met. And again, in addition to that, you know, we provide, you know, art therapy and music therapy, and we have Reiki and yoga and all these other things for kind of soothing the mind. So again, we have it all. We really do.
So just to kind of wrap it up, do you feel that there's any one substance that you see more often in the older adult population versus others? So like, do you feel alcohol is the more prevalent substance when it comes to older adults?
Absolutely. Unfortunately, alcohol and opiates are running pretty close, but we would, if you had to put one above the other, it definitely would be alcohol. It's the most socially acceptable substance out there. One that a lot of times people don't even identify as a problem until there is a problem. But due to what we talked about earlier, the symptoms and signs of aging and, you know, falls or any type of injury that leads to the need for an opiate. And I think a lot of times, because an older person is experiencing pain to begin with, just because of the many years on the body, med seeking in an older adult is less it's slower to identify. You know, sometimes like a 20-year-old or young person that's that seems to be complaining about pain is often identified very much sooner than an older adult, because we expect someone older to start experiencing the aches and pains of a long, well-lived life. We just do. So, we've seen more and more opiates as well, but alcohol definitely the primary.
So is there anything else that you feel that you wanted to discuss about our older adult population today, or in regards to Recovery Centers of America?
No, what I would just suggest is that if you have a concern, and hopefully you're able to, I don't know if you're able to give out my information and how you do that, but I'm always available to answer any questions about our older adult population. If for any reason someone had questions that and wasn't able to get a hold of me, we do have our 1-800 recovery number. I know that if they reach out to you, you are able to direct them to me. We want to serve this population, and we want to be, a resource in our community for everyone. And if we're going to be a resource for everyone, there are certain populations that we have to and have identified there being a need for substance use disorder treatment. And this is one of those populations.
Yeah, absolutely. And like you said, if anyone ever has any questions or concerns about substance use, they can always reach out to Southwest Counsel at 1-800-856-9609. And they can also reach out to 1-800-RECOVERY for Recovery Centers of America. All right. Thank you so much, Kelsey. And I appreciate you coming out and talking with us today.
I appreciate you having me.